Good morning. We are going to be starting here in a couple of minutes. I'm going to give a few more folks a second here to just get logged in, and then we'll get started hearing all about Medicare 101. All right, we're going to go ahead and get started here today. Thanks everybody for joining us for part 2 of our webinar series. Today we're going to be talking about Medicare, and we had the fortune of listening to Belinda talk about Medicare about a year or so ago. My staff and I listened to this same presentation, and for those of us that work in this industry, I thought, well, there can't be too much I don't know about Medicare. You know, I am in the insurance industry after all. And we all walked away going, holy cow, was there so much information that we just really didn't know or didn't understand. And actually, when my mother was probably listening in, but when she was eligible for Medicare, you know, she was asking me questions about it. And I thought, okay, well, I know this industry shouldn't be too tough. And so I went on the Medicare.gov website and, you know, looked around, looked at the different plans and all the rules. And after several hours, I went, I have no idea what I'm doing, didn't understand it at all. So I promptly called their helpline, and I call it a helpline in the loosest sense of the term. But I called the 1-800-Medicare, whatever the helpline is. And after another hour on the phone with a very helpful person who knew less than I did, I went, I just am completely lost. And so my mom and I sort of muddled our way through it. And ultimately, I actually had her meet with Belinda because I just don't know it. So we are very lucky to have what I think is the best person for Medicare. She just really knows more than anyone I've ever met about Medicare and how to protect yourself by knowing enough about it to keep yourself out of trouble and get the most out of the benefits that are provided and the supplemental plans. And I won't steal thunder by talking too much about it, but I wanted to talk to you a little bit about how we ended up with Belinda here today. That's me. It's Gisela Smith, for those that don't recognize my voice from the last webinar series. And I'm not going to take much time. I want to use all the time we have here today to have Belinda really share her expertise on the topic. I'll tell you a little bit about Belinda, though, and there she is, beautiful Belinda. She is married. She has 6 grown daughters and 7 grandchildren, lives here in Ventura County as well, which is where our main office is. She's been doing Medicare for about 10 years after I get somewhat dumped into it because no one else could do it. And so she has since become just the expert on Medicare. And I think you'll really enjoy hearing her talk today. We were talking about some stories with Medicare, and I shared my story about not knowing anything about Medicare and trying to fumble my way through it. And we had a funny discussion about a client of hers who was literally a rocket scientist. And after trying to fumble his way through Medicare for Dummies books and all these other things, he went, if a rocket scientist can't figure it out, who can, right? And so Belinda will help all of us here figure it out today. And as always, you can send in your questions on the chat. I will try and get to them as we go along. Belinda will ask any questions you have, but again, just type them into the chat, and we'll have a little poll as we go along. And with that, I'll go ahead and let Belinda take over.
Well, thank you, Gisela. I appreciate being here today. What we're going to do is cover a lot of the real basics of Medicare, like Gisela said, to keep yourself out of trouble and to at least understand how Medicare works so you know which direction to go. This picture is actually a client of ours, and this is the mail that she received within just 1 week. And this didn't count all the other weeks leading up to her birthday. So she was, to say the least, very overwhelmed. A lot of the main questions for Medicare, of course, how do you qualify? And what is Medicare? What is its purpose? Is it automatic? How much does it cost? Are you required to take it? How do you get enrolled? What if you have a health savings account? That's a tricky question, something you need to be aware of. Nobody wants any tax penalties there. And what does Medicare cover? What are the gaps? Because we certainly want to worry about the gaps and what's going to be, in the bag that we're left holding. And then, of course, what are the differences between a Medigap, which is also called a Medicare Supplement Plan, and a Medicare Advantage plan? So how does somebody qualify for Medicare? Obviously, we all know the big turning 65, but it's also for people who have been disabled for the 24 consecutive months. So, what they do for that 24 months, I don't know. But once they are disabled for the consecutive 24 months, they now qualify for Medicare. And of course, anyone with that end-stage renal disease. Is Medicare automatic? Well, once again, this is a little bit tricky and a little bit, each case is a little bit different. Some people take their Social Security benefits early, let's say at age 62. If they are taking Social Security at age 62, then their Medicare A and B is automatic for age 65. In other words, they really need to do nothing. Their card will come about 3 months before their 65th birthday. However, they still have the option of delaying Part A and B if they don't want it. So if you are already taking Social Security, you want to be on the lookout for that card from the Social Security Administration that says, if you don't want A and B, please fill out this card and mail it back. And then, of course, if you haven't signed up for Social Security, let's say those of us who want to put that off until we're age 70, then you have to actively sign up for Medicare A and B. And so you want to make sure that you are taking that action at the appropriate time. It is not a fast process. Remember, we're dealing with the federal government here. It's going to take a while, 4 to 6 weeks once you sign up for A and B until you get the ID card. You can sign up for that A and B about 90 days before the month of your birthday. So let's say your birthday is July 1. Well, July 20th. Your Medicare will be effective July 1. So you have 90 days prior to July 1 to sign up for that A and B. Once that A and B is going and you get the welcome letter to Medicare and you have your ID card, then that's when we would move forward and get the plans that go with the Medicare. So realize you've got a process. I've had some clients call me and, hey, I'm turning 65 in 3 weeks. Let's get this going. Well, that's just next to impossible. So it has to then be delayed a month or so. So just be aware that there are timetables with Medicare. You must do what you need to do at the appropriate time in order for everything to fall into place. And then, of course, you can sign up for A and B online through the Social Security office, and that is ssa.gov. Now, I want to address something here, too, is that you don't always have to sign up for A and B at the same time. Let's say you continue to work and you have employer coverage. Well, you could sign up for A only if you wanted to. That would give you a little cushion of hospitalization coverage. You don't pay for Part A because you've worked 10 years or 40 quarters. And then you would just delay Part B. So that is an individual, choice and situation. We can talk about that, but just know that it is possible to sign up for A only for a while and delay Part B if you're going to continue to work.
All right, and Belinda, we do have a couple of questions as we're moving on. So one of them has to do with if someone is new to the U.S. and hasn't paid into Social Security, can they still pay the Part A and B premiums and buy a supplement plan, or can they not participate at all?
Well, they do have to be a citizen. They do have to have that. Part A in and of itself is about $450 a month if they have not paid into the system. So it gets a little cost prohibitive sometimes. You've got Part A at that $450, the Part B premium, let's just say it's $134, then they would have their drug plan costs and the copays. So sometimes it's a little cost prohibitive for some folks to do that. Can be done, but it does add up.
So that's we need to call you and you'll figure
Correct.
it out.
Yeah, well, that is a case-specific situation for sure.
All right, we'll get to a few more questions here in a second, but let's go ahead and get into what exactly is all the Part A, Part B. This alphabet is very confusing.
Yes, and they add to it down the road as well. So, but of course, we know that Part A is the hospitalization, Part B is the doctor's visits, the lab work, the durable medical equipment, and injectables given by a professional. And I will say that sometimes I'll have clients call me and the doctor's office keeps trying to bill Part D for the injectable when actually an injectable given by a professional is covered under Medicare. So that's a different billing process. And then of course we have Part C, which is the Medicare Advantage plan. Once again, clarification here, Medicare Advantage plans are given by private insurance companies. It is not Medicare. Medicare governs it, but it is given through private insurance company, as we all know, whether it's United Healthcare, Blue Shield, Humana, whomever. And then Part D, once again, is also private insurance companies. And just remember, Part D is for drugs.
Okay, so I think we've got A is the hospital. B, the big thing to remember is injectables are included in the B, not in the D down below. Okay, so that helps. All right.
All righty, and here again, then we're talking about the Part A. For most of us who have put in 10 years of working or 40 quarters, keep in mind that does not have to be consecutive either, but at least that 10 years of working, we get Part A for a 0 premium, so that really helps us out. Most people do not have that premium. Again, if you've got somebody coming in, perhaps.
Okay.
So that all comes as you're paying out of your paychecks each month.
Oh, fabulous.
Yep, one of those little nifty tricks in there that you're like, oh, that's what I pay.
But so that's obviously why, so a lot of my clients will say that their patients are coming in saying, oh, I'm soon going to be on Part A. What do I need to do to switch my care? But once they've got their card and they go into the doctor's office with their card, then the Part A and Part B stuff will all be shown on that card that they have.
Correct,
both.
that's what they're registering for, yeah.
Okay. All right.
All righty. And of course, for Part B, everyone pays a premium for Part B. Now, most people will fall within that $134 a month premium for Part B. That is income related. So if you look over on the right side of the screen there, you'll see that if you're single and you make $85,000 a year or less, you will pay the $134. Keep in mind that is adjusted gross income. And then, of course, if you're married, it's $170,000. So if someone makes above that, then this $134 continues to go up in increments depending on their income level. Now, one thing I want to point out here is people might say, well, okay, I'm working and I make $300,000 a year, but when I retire, I'm going to be down to $125. And it's always a 2-year look back. So Medicare looks back 2 years. Well, 2 years ago, they made the $300,000. But now that they're retiring, it's going to be, let's say, $125. So what I do is I give them what's called an income adjustment form that they fill out and take over to the Social Security office to ask them to adjust it down according to what they're going to have during retirement. Now, I always tell people, do not grossly underestimate because they will come back after you for the difference. So let's say the following year, you're now filing taxes, and let's say in retirement, you actually made $275. They're going to come after you for that difference. So don't grossly, but stick. I have not had a client yet that they have not adjusted it down.
Okay. And is there a max that they will increase based on annual income? Is there?
There is. The next chart after this, after we.
I'm jumping ahead is what you're saying.
That's okay. Right here, the higher premiums right here, you can see where that falls in. So once someone is at $428,000 a year, you could go way beyond that and you're still only going to have that $428,000. But of course, in retirement, we typically do have less coming in than when we're actively working. So that form is really important for folks.
Oh, so it's good to know, though, that you have the opportunity to sort of appeal the premiums.
Correct, yeah.
And if you're retired, you have plenty of time on your hands for which to fill out the form and
Correct.
go to Social Security.
There you go, exactly.
All righty.
All righty, so Part B, are you required to enroll in Part B? Well, they want to tell us that Part B is voluntary. However, if we decline Part B, we are subject to that 10% penalty. So that doesn't sound very voluntary to me. Once again, if you are working full-time and have employer coverage that is creditable, you do not have a penalty. So I had a guy who worked till he was 75 and he had employer group coverage. It was creditable, had no penalties whatsoever. It's when you get into the tricky areas. I've had people retire and say, I don't really need coverage. I'm really healthy. I'm going to delay this for a year or two. And they definitely have a penalty. I want you to look at the bottom where it gives you the example. So for every year someone goes without Part B when they should have had it, they will have $13.40 per month for life as a penalty. So let's say they go 3 years. Well, now we're upwards of almost $40 a month extra that they will pay per month, and it never goes away for the rest of their life. And with Part B, there can be this really hairy, you have to do it when you should have done it. Otherwise, you could go without that coverage for 6 months until they make it effective for you. And we'll kind of talk about that a little bit. And here again, the exceptions for that Part B late enrollment penalty are that if you are actively working and covered by your group insurance, you will not have a Part B late enrollment penalty for Part B. If you are on your spouse's coverage who is actively working and they have employer coverage, etc., you are fine there as well. No penalty. The trick comes that if someone delays that Part B when they should have, then we really have issues. And sometimes people can have months of issues and no coverage. So we want to be careful of that.
Okay, and again, some more questions here. So one question that we've had before, and we're getting it again, is, so let's take the smaller physician office where the physician has a policy which they consider to be an employer plan, but it's just that person on the policy. Would that still be an exception to the late enrollment?
No,
It
not
has
an
to be
exception
an
at all.
employer plan.
It does have to be an employer plan. If that physician's plan has that physician's name on it as the holder of that policy, and let's say it's only him and his wife on that policy, we can be in trouble because it is considered a personal policy. So once they are at age 65, well, prior to age 65, they should be signing up for Medicare. Number one, they're going to save a ton of money anyway, so why wouldn't they? And so there's one plus side of it, but they need to be careful of that if that policy, even if they have, a child on it, they have an employee on it, a secretary or whatever, they have to be careful, because if that policy is listed as their name and not an employer group, they can run into issues. I had a law firm that was how it was, and that guy had 3 years of penalties on everything, on Part B and Part D, because he didn't know it was under his name and he held the policy. So it's always a good idea, give me a call, we'll walk through it, we'll talk through it so that you know exactly what you need to do and when, so that you don't have that issue.
All right, and I'm going to take a break again for one more question, and then we'll go on to the next slide. I'll read out the scenario here. My full retirement age is 66 this September. I'm enrolled in Medicare Part A. I do not plan on retiring this September. I was married for 27 years. Ex-spouse is collecting Social Security benefits. I was told that I can apply to collect on his Social Security benefits as long as I'm not yet collecting, as long as I do not make over a certain amount in the time frame between January and September of my full retirement age. Still following me? Because I'm already lost. Once I'm at full retirement age, there is no limit to my earnings, and I can continue to collect a portion of his Social Security benefits as long as I'm not collecting my benefits. Is this true?
Okay. So yes, she has every right at any time, as long as he is pulling his benefits. She could be age 62 and still pull her portion of his benefits. She has every right to do that. And then she can just simply delay her benefits until she's 70. And then at age 70, depending on which is more, whether it's the spousal benefits that's more or whether it's her benefits that are more, she can then at age 70 make that decision as to which way she wants to go.
All right.
I hope that answered that one.
All right, let's keep going.
All righty. So here's one trick is if your plan is an HSA, then you should not have any portion of Medicare if you want to continue to put into the HSA. If you do, then what's going to happen is you're going to get some tax penalties, and we don't want that to happen. So if your plan is an HSA, do not enroll in any portion of Medicare. If you do not have an HSA, then you don't need to worry about it, and you can certainly, let's say, enroll in Part A only if you wanted to have that cushion of hospitalization coverage, and then you could delay Part B until you decide that you're going to retire. So just be on the lookout for those HSAs. Don't assume that you can put money in there and you're still okay. Clarification, if it is your spouse that has the HSA and they are not going on to Medicare, let's say they're 62, you're 65, they can put as much money as they want in that HSA because it's under their name. You can utilize the monies, you just cannot contribute to it under your name and social security number.
All right, we're going to go to our poll here for a second about Part B. So all of you that are out there on our poll, if you can just scroll down, you will see a few tabs, and one of them says polls. Go ahead and click on the tab that says polls, and you'll find a couple of questions there. First one is, if you miss your Part B enrollment time period, when can you sign up? So go ahead and give us your best guess. And there's 3 options there, so click on your answer. See people already clicking in. And then the second part of the question is, when will it be effective? In other words, when will the Part B actually be effective? And you can answer on both of those. And I'll give you guys a few moments to click in on your poll, and we'll continue talking as we go along on this. And then I'll come back and check the poll here in a second.
Okay, what I wanted to point out here on this Medicare Part A, yes, it's inpatient care in the hospital, skilled nursing facility, hospice care, and home health care. What I want you to notice is what is not listed there. Medicare does not cover long-term care. Now, it will take care of your health needs. It will not pay the rent for you to live in a long-term care facility. And a lot of times people are very confused about this, and they think that, oh, I've got it covered, I've got Medicare. It doesn't work that way. So it won't pay your rent to live somewhere, but it will certainly take care of your medical needs while you're there. Skilled nursing facility, keep in mind that's a facility where the physician expects the patient to get better. In other words, with some physical therapy, etc., they're going to get better. So skilled nursing facility is definitely different than long-term care.
Okay. Yeah, I get a lot of questions about in that area as well.
And then, of course, we do have some gaps in Part A. If someone were to have, let's say, Medicare A and B only, and they did nothing else, they didn't get a Medicare Advantage plan, they didn't get a Medicare Supplement plan or Medigap plan, they would pay just about 20% of everything, including a hospital stay, and there is no limit to that. So in other words, if somebody has a $400,000 heart surgery and they only have A and B, they're stuck for 80 grand. So we don't want that to happen either. And I do run across folks that think they're covered because they have A and B. So that gets a little scary, but those are the gaps for Part A.
And you're talking about, so there's a deductible to be met first, and then additionally you remain on this 20% copay without a limit.
If you only have A and B.
Got it.
And that's why we want to have at least the Med Advantage plan to cap that off, or the Medicare Supplement plan that is some pretty comprehensive coverage. So.
Okay, anything to point out on the skilled nursing for Part A, or is that pretty self-explanatory, you think?
Yeah, no, that first, 20 days, there is definitely a 0, which is good. Most people are in and out within that 20 days, but heavens forbid you go into the 45th day, you're paying $161 per day. So, okay. And of course, Medicare Part B also has its gaps. But what does Medicare Part B cover? It has the doctor's visits, outpatient care, labs and x-rays, and then of course your therapies, your physical, occupational, and chemotherapy. And I want to put on here injectables as well.
All right, let's go back to our poll here for a second. And Belinda, you can tell us how well all of our listeners here guessed. So if you miss your Part B enrollment time period, when can you sign up? The most guesses we had is January. Secondly, with May and July had no guesses.
Okay, and January is it. It's actually January through February 14th, but it is that beginning of the year. I tell people, do not wait. If you miss it, you're out for another year. So you want to be aware of that. And then when will it be effective? We got a war going on here between between July and March. But yeah, July is the answer. So if someone misses that important enrollment period when they should have enrolled, and when they should have enrolled is either right at 65 or when they're retiring, prior to, like 3 months before they retire, they sign up. Those are the two guaranteed no matter what time of year it is. So if somebody retires in March, well, then it's effective in March. But if they have delayed signing up for Part B, then it would be effective, or they would sign up in January through February 14th, and then it's effective July 1. So they can wait a time period and have no coverage. And I'll share a quick example. I was talking with Gisela about this a little bit earlier. I had a client who, unfortunately, he went on COBRA when he retired. That is one of the worst things you can do. So he went on COBRA. Medicare does not deem COBRA as being creditable. So his COBRA went a year and a half. He came to me. Medicare said, oh, well, great, but you missed your Part B enrollment period, so we'll let you sign up in January. It will be effective July 1. That's 6 months with no coverage, because keep in mind his COBRA ended and he was a heart transplant patient. So that was very, very traumatic for him and his wife. They were beside themselves, but nobody told them. So keep in mind, you do not want to do COBRA if you are over 65. Okay, so gaps in Part B. Basically, Part B gives you a $183 deductible, and then of course 20% of any cost that are covered under Part B, whether that's an x-ray, lab work, etc. And then the other thing we need to be aware of is that Medicare has other gaps as well. It does not cover care outside of the US, and I'll qualify that. Some plans do give a $50,000 of emergency coverage only outside of the US. That is life and death coverage. It doesn't cover dental services, nursing home expenses, excess doctor charges, routine vision care, glasses, and hearing aids. And some people think that all of that, the hearing aids, glasses, and vision, what do we need as we age? We need vision care, we need glasses, we need hearing aids, etc. Which Medicare is in discussion of including that. As you know, that's a slow moving train. It may not happen for several years, but the conversation is at least happening. But know that right now that's not covered routinely. Okay, so here we have the slide that kind of explains the options we have. Number one, we have the problem that Medicare itself, A and B, only cover 80%. So that leaves us that 20%. What are we going to do to cover all or most of that 20%? So we have two options. We have a Medicare Advantage plan and we have a Medicare Supplement plan. Now let's flip back over to the one umbrella plan. How that works is your Medicare A and B benefits are shifted underneath that umbrella to be administrated by that carrier. So it's like you take one hand and slap it over the other, and now it's that plan that determines where you can go with Medicare. Hence a network, an HMO. In some areas, there's still some PPOs left, but a lot of areas it's an HMO. So they determine where you can go for care. Part C, we've heard of that Advantage plan, Part C. They're going to have some perks in there. They may have 2 dental cleanings a year. Now keep in mind, that's dental cleanings, not dental work. They may have 2 dental cleanings a year. They may have 6 chiropractic visits a year, something to pull you in to make you like their plan. And then a lot of times those plans will include the drug coverage. So you can think of it as the advantage of holding just one umbrella. Everything falls under that one umbrella, or hence that one card in your wallet. A lot of times these plans will have a 0 to low premium, which is great going in, but other considerations is there are copays, deductibles, out-of-pocket limits should you go in the hospital, and then of course you've got that HMO network, and in some areas PPO. That out-of-pocket limit varies per plan, and I kind of took the average $3,000 up to $6,700, and sometimes that can be twice a year. So let's say, depending on the plan, let's say you go in March for an elbow problem. You're in the hospital for 3 or 4 days. And then again, you go in October, well, now it's a knee problem. Well, that's a whole different benefit period because they're unrelated. So we need to be careful there and ask questions about your plan in that regard before you commit. But that can be, in the end, a lot more out of pocket than the flip side. So let's talk about the flip side, the Medicare supplement right now. This side works entirely different than the Med Advantage side. Your A and B benefits will stay being administered by Medicare. So you're going to carry that card in your wallet, that red, white, and blue card. And then you purchase a supplement, and then you still have to purchase a separate Part D plan. And so within the supplement world, once again, they're throwing more alphabet at us, and the plans are named by letters. And I've only got 2 listed here. There's too many to put on this slide, but F is the Cadillac plan. So you know you're going to have a premium for that. However, you're going to have 0 copays, 0 deductibles, 0 out-of-pocket limit, and no network. What does that mean? That means you can walk into the doctor, walk out, not owe a dime. You can go in for lab work, walk out, not owe a dime. You could go in the hospital for hip surgery, knee surgery, heart surgery, doesn't matter, and get wheeled out and not owe a dime. So the premium on that is not astronomical. I personally cannot wait to be on Medicare compared to what I'm paying now. So we're really looking at that Plan F, depending on your age, but I'd say anywhere from $150 to $200 as you're first getting in. And then Plan G, there's a slight difference between G, that also has a premium, and the only difference is that it has, and that slide reverted back, it's now $183 deductible. Instead of $166. So I'm going to have to resave that one, but it is $183 deductible is all. And then it acts exactly like Plan F. And then there's a Plan N, has a little bit more out of pocket. I have a lot of folks that choose that one because they feel like, well, I don't go to the doctor that often, and I'm willing to pay a copay when I go to the doctor, etc. So we can certainly talk about that if somebody has questions further on that.
So talking just pricing comparison, because that's what most people I think will consider. So if you went on to this Medicare Advantage, which I'm going to call it the Medicare HMO,
okay,
it's the easiest way for me to understand it, then it's great, no deductibles and generally no premiums?
No, not on the Advantage side. On the Advantage side, there's 0 to low premium, depending on the plan.
Okay.
But you are going to pay every time you go to the doctor, every time you have lab work. If you go into the hospital, you could very well end up with, let's say, $5,000 out of pocket.
Okay, so no
this one
monthly premiums,
correct.
but you have these other considerations.
Yeah, they're going to get you on the other end.
Okay, and then if you go into the supplement world, you right now are only talking about this F and G supplement plan, and I'm guessing you're going to get to the prescription Part B piece in a second. All right, great.
Okay, so here we are on Part D, and once again, they want to tell you that Part D is voluntary, but if you don't sign up for it when you should have, then again, you have a penalty. Now that accrues monthly, not yearly, but monthly. And I've had people who come to me 3 years after, well, I didn't have any prescriptions I took, so I didn't sign up. Well, now they're paying an extra $18, $20 a month for their drug plan now that they need it. I had one gal come to me. It was actually her son came to me. She had gone without prescription drug coverage for so long. Now she was taking several expensive medications. It was actually cost prohibitive. It was, well, she might as well just pay cash and find a way to get discounts. It wasn't worth it. There was so much penalty that had accrued. So keep in mind that even if you do not take prescription drugs, you want to sign up for at least the lowest cost premium drug plan, whether that's $20, $18, $24, whatever. You want to have that coverage. And really the reason, people get really upset about this, and bottom line is they want everyone to play the game. They don't want you to say, hey, I don't take prescriptions, so I'm not going to sign up. 5 years later, you need super expensive cancer medications, but yet you've never put into the system. You've never played the game. So they think it's fair if everyone plays the game. And you don't know what, antibiotic you might need or what cream you might need, randomly here and there as well that you can get through the plan. So just keep that in mind. In my opinion, not a good idea to delay Part B or D. You should sign up when you sign up for everything else.
And that could be pretty minimal monthly. You're saying
Correct.
the lowest one, $20 a
Mhm.
month. So, okay.
Right. And if you accrue, let's say you go 3 years without a plan, okay, that's $20 a month you're saving, but now you've got $20 a month in premium extra, and you pay that the rest of your life. It far outweighs having a plan for 3 years that you might not have used. All right, so when can you enroll in a Medigap plan or Medicare supplement plan? These work a little bit differently in that they don't necessarily have enrollment periods. So you're guaranteed issue if you enroll in a supplement plan within 6 months of your Part B effective date. But let's say you delay it and you get Medicare A and B and you don't get a supplement, well, you may not be guaranteed issue. If you have certain health issues, it's just an automatic denial. So be aware of that. It's not the same rules as what the Affordable Care Act has done, where there's no pre-existing. In a Medicare supplement plan, if you do not sign up when you first are eligible, you are not guaranteed issue, and you will have to go through the underwriting. So if you have, if there's diabetes, glaucoma, back issues, heart issues, you had, surgery in the last 2 years, et cetera, and especially if there's 2 or more of those combined, you could very well be denied and then be locked into the HMO side. Depending on the state, sometimes we can do a little bit of dancing and maneuvering around, but not real likely or guaranteed. So I hate to even put that out there. But please be aware, if you do what you need to do when you need to do it, you can have the plan that you want. Alrighty. So when can you enroll in a Medicare Advantage or HMO plan or the Part D? Of course, because they are HMOs, they are zip code driven. So we have to be aware of that. You must live within the service area. You cannot have the end stage renal disease. And then of course, you must have Part A and B, and you must have an election period. So whether that election period is that you're turning 65, whether that election period is that you're just now going to retire, or perhaps you moved from one zip code over to another zip code. Well, now you have a new election period. So keep that in mind. Plan Ds, they are zip code driven as well. But let's say that you choose a plan, you're now in retirement, you've got a drug plan, and you go to Walmart or to Walgreens or CVS. Well, they're national. And most of the time, all you have to do is say, hey, I'm visiting from XYZ state. Their systems talk to each other, and you can pick up your medication at one that's out of state. So just be aware. Okay, everybody wants to know about the dreaded donut hole. Did we want to answer that? Okay.
Yeah, I'm going to leave. There's a few more questions coming in. I'll leave them for the end because we're getting a little tight on time, and I want to let those folks who need to go ahead.
Okay, perfect. So we're going to talk about the dreaded donut hole, which everyone asks me about. Try to understand how in the world does this thing work. So in the beginning, the carrier and you pay so much toward your medications. And when you and the carrier together have reached $3,750, you fall down into the donut hole, where now you're going to pay more for your medications. You're going to pay 44% of generics, 35% of brand, and 33% of specialty drugs. So specialty drugs, as you know, are like the cancer meds, etc. So, basically the carrier throws their hands in the air and says, okay, we're done paying so much. You're going to pay more now. So now you go through this donut hole. And when you have reached $5,000 out of pocket, keep in mind it counts, the first bucket that you paid into counts. So let's go back to that first bucket and say that you paid $1,000 out of that $3,750. That $1,000 carries over to the third bucket there. So now you really have an additional $4,000 to dish out. Once you reach that $5,000, then you pop back up into catastrophic, and the carrier says, okay, we feel sorry for you now. We're going to pay much more for your medication. So you're going to pay $3 to $7 or 5% for most of your medications during that period. Keep in mind, though, once again, people are still going to be paying that 33% for those specialty meds. Now, we all know that they're adjusting the donut hole, and things will get better by 2025. We don't know what's happening, really at this point. As it stands today, this is how it works. But just understand that there is the 33% for specialty no matter where you're at. Okay, so what are the rules for enrolling in a Medicare Advantage plan in Part D? Well, obviously when we turn 65, it's our initial election period. So we can join any plan that we want, whether it's a Medicare Advantage plan or it's a Medicare supplement plan. Guaranteed issue, no questions asked. And then we have the annual election period. So once someone is already on Medicare, every single year during the annual election period, October 15th through December 7th, they give you a chance to shop around. And this is something that I make sure to do with every one of my clients, is to review their drug coverage, because every year those plans make changes. They drop drugs off, they, change the tiers. And then of course, each individual's medications might have changed through the year. So it gives us just a chance to shop for that drug plan, a new one perhaps, or if they're on a Med Advantage plan, to shop a new Med Advantage plan. The supplement typically will stay with you for life. And then of course, there's the special election period. So for qualifying events, and those events basically are that you've moved from one plan or from one state to another, or one city to another, etc. So that's basically about it on that.
Great. Well, we have a question that came in that I'd like you to answer before we finish up here. So any final questions, go ahead and get them in. This one came in a few slides ago. So it says, I'm not retired. I'm covered under group insurance, so I only signed up and took Part A. Will I have no penalty when I no longer am covered by my group insurance and I actually retire? And can I at that time sign up for the Part B and D?
That's correct. That's correct. So about 3 months prior to your retirement, you're going to want to get that going, Part B, because that does take a while. So about 3 months prior to retirement, if you can, go ahead and get Part B initiated. Since you already have A, you will have to go into the Social Security office to get Part B.
Physically walk into the Social Security?
Physically walk in, yes. And I always suggest, show up 30 minutes before they open. You can be one of the first 10 people through the door. That's the best thing to do. But you will have to go into the office to get Part B. And then once Part B is effective, then you can visit with me or another agent. And then that way you will determine, do I want a Med Advantage HMO side, which includes drug coverage, or do I want the supplement with the separate Part D? And that's something to consider. And especially if you're traveling, if you plan on traveling throughout the United States, I would suggest the supplement in Part D, because you can go anywhere in the nation with that plan.
So that's a good point, because it's not on an HMO network.
Correct.
You can travel all around.
Yep.
And hopefully everybody's traveling in their retirement. So
at least a little bit. Yeah. And you don't have to have Social Security in order to get Medicare. Sometimes people think that they're tied to each other. They're not. You can delay Social Security till you're 70, let's say, but you can get Medicare at 65. Or you can take your Social Security out and delay Medicare because you're working still and you really don't need it until you retire. So they're not tied together. You don't have to have both at the same time. So.
Okay. Any final comments, which obviously a lot of our listeners are in the healthcare arena, so they're the ones seeing patients who have Medicare. Any tips or tricks or anything they need to know? It sounds to me like if I have a patient coming in that has the red, white, and blue card, Part A and Part B, plus a supplement, plus D, I collect nothing from them, correct?
That's correct. No co-pays, no anything. But of course, then they bill out to Medicare. Medicare deems whatever they're going to pay. And then Medicare should, not always, but Medicare's supposed to send the remaining of the bill to the supplement plan, and then they pay. So then the doctor gets that 100%, whatever Medicare deems is 100%. So yeah.
Okay. All right. And so that was also a question we had. And then one last one. It looks like I do not opt to collect from my ex-spouse's benefit at 66. Do I have to wait until age 70, or can I collect at any time as long as I'm not collecting Social Security benefits?
Yeah, they can collect from their ex-spouse even at age 62 if that person is already collecting theirs. If not, then they would be able to collect from their ex-spouse at age 66. And they can collect for the 4 years until they're 70. And then they can determine which is more, my ex-spouse's or my Social Security benefits at age 70. And then they can make a choice.
Okay. All of you, I think, can see there, that's Belinda's contact information. We'll also have this on our social media, on our website, on our LinkedIn. We'll include a recording of this webinar for those of you who didn't get enough of Medicare this morning. You can listen to it all over again. You just can't vote on our poll again. But I know it's really good information. It's important. Share it as you can with your parents, your colleagues, your friends. Staff want to listen to it. I know that it helps to clear up a lot of the misconceptions about Medicare. And any other questions, final questions you have, go ahead and email Belinda directly or send them into our office. And we will be seeing you at our next webinar series, I would say next month. And the topic is negotiation skills. And I believe I'm the featured speaker. So we'll see you all next month. Everybody have a good day.
Thank you.